That brings me very nicely to our last presenter for this session, Dr. Mitra Saadatian-Elahi from the University of Lyon, who's actually here representing on behalf of Bayer Vector Control. We've had Maxime Leduc and Justin McBeath, who've just joined our dengue advisory group, which we're very honored for that and very happy for that. And they put forward Dr. Mitra to represent Bayer Vector Control and show really a very, very in-depth study that they've started, and I believe almost to completion, a 2-year study. And I believe it's one of the largest randomized controlled trials in the world, looking at targeted vector control activities, so targeted fogging, the interplay between community behavior, and also one of the lines out of this is building a socioeconomic case for which of these technologies they're targeting, fogging or a new form of dissemination, auto-dissemination, trapping, what's working and what's not working, and the kind of interplay with community as well. So I think without kind of going too much into this, because I'll just hand over the floor to Mitra. Dr. Saadatian-Elahi, thank you so very, very much for joining us from Lyon, and over to you.
Thanks a lot again to the organizer for giving me the opportunity to provide some information about our ongoing trial, IDEM, which means Intervention for Dengue Epidemiology in Malaysia. So IDEM is a cluster randomized controlled trial engaging cross-sectoral collaboration, and our ambition is to measure the effectiveness of an integrated vector control management on the incidence of dengue in Malaysia. Next, please. But just before going into the details about our trial, I would like to give you a very quick information about the epidemiology of dengue in Malaysia. Malaysia, which is a very hot spot for dengue and also a state-of-the-art of reporting system. Next, please. As you all know, Malaysia is endemic for dengue, and it puts the whole population at the risk of infection. The highest transmission rates are observed in general in late monsoon season, which is from October to February in East Peninsular Malaysia and from July to August in West Peninsular Malaysia. The main preventive control measures already in place are reactive vector control management within 24 hours of a dengue case being reported, and it consists of a space spray, source reduction, and larviciding. Next, please. Here you see just a quick information about the number of dengue cases in 2020 and 2021. And as you can see, we have almost 4-time reduction in the number of dengue cases in as of May 8, 2021, as compared to 2020. I don't know how to explain this huge reduction, but of course, most probably several quarantines that were put in place during the COVID pandemic, and also probably a decreased activity of dengue, which is known to be cyclic in Malaysia, can at least almost explain a part of this reduction. Next, please. As you can see here, all 4 dengue serotypes circulate in this country. And with the exception of serotype 4, which seems to be less common in from 2014, the dominance of other type varies over time. Next, please. Malaysia has a very strong surveillance infrastructure in place that include, of course, the national e-dengue system, which records all laboratory confirmed cases but also their socio-demographic and clinical information, together with vector control activities carried out as soon as a dengue case is identified. The system is updated every day. There is also a network of more than 40 nationwide laboratories that collect blood samples to serotype the dengue virus. The country monitor also insecticide resistance and population density of the mosquitoes. Next, please. So, in a summary, Malaysia is endemic for dengue, has a very good dengue surveillance infrastructure in place. And we have also the support of the Malaysian Ministry of Health to set up our trial. These three reasons are the main reason why Malaysia is a very appropriate location to do such a large trial, as you will see later. Next, and even next, please. So, yeah, thank you. So, all this being said, I am going now to present you some more information about our trial. So, IDEM is run by a cross-sector synergy between academic and private partnership. The team members include, of course, entomologists, biostatisticians, and epidemiologists. Next, please. So here you can see the catchment area is the federal territory of Kuala Lumpur and Putrajaya. In green, you can see the intervention area, and in red, we have the control area. I will explain in a few minutes how we selected our clusters. Each point is a locality, which for us is a cluster. And in Malaysia, a locality is a number of buildings which are together and which share some spaces such as parkings and shops. Next, please. So our trial is conducted in low and medium cost building where almost 50% of dengue cases occur. Next, please. Here you see the flowchart of the trial. Clusters in the federal territory of Kuala Lumpur and Putrajaya with recurrent dengue outbreak reported from 2015 to 2018 were eligible to participate. After removing some of these clusters due to different reasons which are highlighted in the slides, we ended up with 319 clusters, of which we took 300 with highest incidence rate to be randomized to the control or intervention arm. The intervention area will receive the proactive vector control activity, while the control arm will have the routine activities already in place in Malaysia. Next, please. Again, next. Thank you. So what are the objectives of our trials? Of course, the first objective is to assess the effectiveness of our proactive integrated vector management on the incidence of dengue in the catchment area. We will also evaluate the effectiveness of the approach on the population density of mosquito and on insecticide resistance. Finally, one of the most important objectives is that, as you know, a vector control program, even efficacy cannot be scaled up if it is not cost effective. So we will do this cost effective analysis in order to compare the routine vector control activities with other proactive activities, because the results of these activities will demonstrate the public health and financial benefits of our approach. Next, please. So as I already mentioned, our IVM, integrated vector management include three main components. The first one is targeted outdoor residual spraying using Cauchin polyzone. As you can see in the pictures, the product is applied to all covered or partly covered walls in all floors in the intervention buildings. Cauchin polyzone will kill the adult mosquitoes landing on the treated walls. We already did a previous study in order to know the residual effect of Cauchin polyzone, and we know that Cauchin polyzone can stay for at least 1 month on the treated walls. And this is very important because this residual effect can potentially reduce the frequency of the insecticide application. In addition, the outdoor character of this application is of particular interest, especially in urban area where coverage of indoor preventive measure is low. Next, please. The second pillar of our intervention vector management approach is the deployment of auto-dissemination devices. These are plastic containers, as you can see in the pictures, that mimic the breeding site for female mosquitoes. The active ingredients are pyroproxyfen and a fungus. So the adult mosquitoes that visit these devices will pick up the pyroproxyfen, and the fungus will kill slowly the adult. So at the end, there is a reduction in the adult Aegypti population by decreasing the emergence of new adult mosquitoes. Next, please. Finally, the last, but of course not the least, component of our approach is community engagement. Very active community engagement throughout the whole study period. We have some people who are very expert in community engagement activities. These activities start with taking an appointment with the community, the head of the communities. A face-to-face meeting, of course, is then organized with management, religious leaders, and volunteers who live in the clusters in order to explain the study and the procedure for the intervention. Of course, now with COVID, the face-to-face meetings are not anymore possible. During these visits, the community engagement managers record at the same time all information about the number of building floors, number of apartment by floors, because we need all this information in order to have the population for the calculation of dengue incidence. We have also then a distribution of all material of education, information, banners, and each community engagement manager has several clusters to have follow-up time to time in order to know about complaints, suggestion, feedback from the community. Next, please. So just this slide and the slide, the following slides show you some pictures about the communication, the community engagement. We have really a very active communication. People are coming. We have a very nice explanation about dengue, and people are free to ask questions. And maybe next slide, please. That show also some pictures. Then normally we take a souvenir picture with the population, and really this interactive communication between the field workers and the community show already its positive impact, because we see really over time we see that people are really willing to participate and to do what we ask them before the intervention. Next, please. So if I can summarize the item strategy, so we have 3 pillars based on a proactive integrated vector management. And I would like to insist on the word proactive, because now and currently the major vector control programs are carried out retroactively. Our rationale on putting such a trial and such a strategy is that using and combining several vector control methods will target different stages of the mosquito lifestyle, and also could have an impact on the management, of course, of the resistance. Community engagement meeting increase the public trust to increase their participation during the follow-up of and during the deployment of the intervention. And we are hoping that it will enhance the efficacy of the control vector program, and also, of course, its impact on the dengue incidence. Next, please. So very quickly, as I told you, the first and the primary outcome is to really have to estimate and to compare the incidence of dengue between the intervention and control area. And we have also secondary outcome, which are of entomological character, and entomological data are collected in a monthly way in 12 clusters in the intervention area and 12 clusters in the control area. Next, please. So our main expectation from the results of this trial are just summarized here. Of course, first of all, we expect to address the current gap on the epidemiological evidence of new vector control tools on the dengue, on the incidence of dengue. We also hope to provide insight that could be of interest to national and international institutions involved in the control of dengue. The planned cost-effectiveness analysis will help to consider the possibility of scaling up this IVM approach at national level, and of course shift the policy agenda from treatment to prevention, thus saving public funds. Of course, dengue has the same vector as other Aedes-borne disease, such as chikungunya or yellow fever. So the results could be beneficial for the setup of vector control programs for other Aedes-borne disease. Next, please. So just to finish, I just would like to tell you where we are with our ongoing project. Next, please. So the first intervention cycle started in February 2020. You can see we have two planning. The first one above show you the initial planning, and below you have the actual planning, and the difference of almost all 11 months comes from the problem of COVID, because we started the intervention in February 2020, almost 1 month before the first quarantine in Malaysia and occurrence of COVID death. And this, of course, this delay led also to an increase of the cost of the trial. And currently, no, we are doing our trial, but we are also looking for other partners, scientists, or other institutions that could bring us science expertise, but also more funding in order for us to be able to finalize the trial. Now, currently, we finished already 3 cycles of intervention, and the 4th cycle started just a few days ago. And the expected date of the end of the intervention is in July 2020. Next, please. I just wanted to show you briefly, you know, the economic cost of dengue, as it was published by Shepard and his collaborators. These data are really based on historical data. And we really would like to do, next please. So our ambition is really to evaluate the real cost effectiveness of our program. Next please, yes. In collaboration with Wageningen University and Research, who has a very important expertise in the field. We know the exact cost of our intervention. We have also already some agreement with the Malaysian Ministry of Health to provide us details about the cost of routine activities in our clusters. We will also have the incidence rate of dengue in both intervention and control area, and with all of this detail, we really expect to be able to perform the cost effectiveness analysis based on really robust data. Next, please. Just to finish, it's we already published three study-related publications, and more are coming soon. Next. And with that, I would like to thank everybody for your attention and for the small problem at the beginning of my presentation. And you are welcome to ask me if a question if you want. Thank you.
Thank you very, very much, Mitra. There was no problem. Do not worry about that. Actually went very smoothly compared to some other webinars that I've seen. So don't worry, it's completely fine. Some amazing in-depth look at your 2-year study, which I'm sure is going to get people thinking. You've put this open kind of call out for more kind of partnerships, collaborations potentially around that. Perhaps this RCT will become a blueprint of how to strive for cross-sector synergy, and it certainly looks like that in terms of the data that you shared with us. And it'll be fascinating to see how that then develops into a paper and some of the recommendations out of that. We are running a little bit away with time. I've been asked that, but I think we'll get some questions in. And for that, I'd like to ask the panelists, Ryan and Soumya, to come back on screen if that's possible. If you're there, that would be great. Ryan, if you're there, excellent, brilliant.